Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, and one on one sessions to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. And I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Question number 1 states, a patient presents to the office today with complaints of dysuria, urgency, and CVA tenderness. A urinalysis was completed with noted positive leukocytes, nitrites, and protein. Based on this information, what is the best diagnosis? Is it A, uncomplicated UTI, B, acute pyelonephritis, C, complicated UTI, or D, stress incontinence? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first because this allows you to slow down and to ensure you're answering what is even being asked of you. So here, the stem of the question states, based on this information, what is the best diagnosis? And you know what I always say, if they're asking about a diagnosis, you need to run it back and look at the assessment findings so you can determine what diagnosis are the best differentials, right? And so when we think of assessment, I always say, look at the signs, the symptoms. What are those chief complaints? What are those subjective findings? What are the objective findings, right? Subjective being, what is the patient's chief complaint? What are they stating is wrong? Objective being, what is the nurse practitioner, the provider, viewing as they're assessing this patient? What assessment findings have they observed, right? So here this patient came in complaining of dysuria, urgency, and CVA tenderness, right? So you're starting to kind of think of urinary issues, UTIs, right? You should start reformulating in your mind. But that CVA tenderness is a key description, key identifier. I always say make sure you're knowing these things. When I say this, you say that, that's my saying. So when I say CVA tenderness, you should say acute pyelonephritis, right? And again, there's no absolutes, it's patient by patient, but the very classic presentation of CVA tenderness, you think acute pyelonephritis. Now, a bit further as we look into it, they did a urinalysis, they're positive for leukocytes and nitrites, letting us know it is a UTI. But then there's also positive protein in the urine, right? So proteinuria. So therefore, that confirms because that is classic also for acute pyelonephritis. So in this scenario, the best answer is B, acute pyelonephritis. All right, question number 2. A 65-year-old male presents to the office today with complaints of dysuria and urgency. Urinalysis was completed with positive leukocytes and nitrites. Based on these findings, what is the best diagnosis? Is it A, complicated UTI, B, uncomplicated UTI, C, acute pyelonephritis, or D, stress incontinence? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, based on these findings, what is the best diagnosis? So again, when asking about a diagnosis, run it back and look at the assessment findings. So this is a 65-year-old male, come in, he's complaining of dysuria and urgency, right? Positive leukocytes and nitrites, so we know UTI. So is it a complicated UTI or uncomplicated UTI? Two things should trigger you to know that this is considered a complicated UTI, right? Males. Males and the elderly and pregnant women are considered categories of complicated UTIs. Due to male anatomy, it's considered complicated. This patient is also 65 years of age. Again, and y'all probably heard me say this in the past. When doing one-on-one sessions, one of my students was like, hey, I really kind of skim across the age and things, but y'all, these are key details. Don't skim across that. Him being a male as well as the age gives you what you need for those answers. So the best answer here is A, complicated UTI. All right, and lastly, question number 3 for today. A 29-year-old female presents to the office today with complaints of malodorous urine and urgency. A urinalysis was completed with noted positive leukocytes and nitrites. Based on these findings, what is the best diagnosis at this time? Is it A, complicated UTI, B, uncomplicated UTI, C, acute pyelonephritis, or D, stress incontinence? Take a moment and tell me what you got. All right, so one more time, the stem of the question here states, based on these findings, what is the best diagnosis at this time? So we have a 29-year-old female came in. She's complaining of malodorous urine and urgency. UA is positive, UTI. Leukocytes and nitrites are positive, so we know it's a UTI. So again, take it back. Look who we're dealing with. It's a female. She has standard complaint signs and symptoms of a UTI with the malodorous urine and urgency, right? Nothing outside of the norm that makes us think anything more complicated. She's 29, young female. So the best answer here is B, an uncomplicated UTI. Remember the importance of understanding why they're complicated versus uncomplicated with UTIs is to help with the treatment as well. For the uncomplicated UTIs, you can treat from anywhere to 3 to 5 days on the antibiotic management. Whereas with the complicated UTIs, anywhere from 7 to 10 days of treatment is how we start out, right? So make sure you identify those categories so you know how to treat from a duration perspective, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. And if you need any of the resources that I offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio1@gmail.com. The things that I do offer, I have a review book that's broken down in the fashion that I teach on assessment, diagnosis, evaluation, and treatment. It is broken down per system. There are interactive sections per system. There are associated medications per system. And there are practice questions and rationales at the end. It is designed for family and adult gero for both exams with an included non-clinical section. So both of those, the ebook as well as paperback option, are both linked in the bio of this channel. Ebook providing you access on any of your devices immediately after purchasing. And then, of course, the paperback will be shipped out. Next is the self-paced independent review. It's on demand, videos per system. You can watch them as many times as you would like with mini quizzes associated with those. That's also linked in the bio of this channel. Our 5-week group review. Next one will be in September, so the link to register will be out soon. I will keep you updated on that. And then lastly are the one-on-one sessions. I do 3 different tier options for one-on-one sessions. You can book it if you need to cover a particular weakness. You can do 1 to 2 weaknesses per session. You can book a one-on-one session for an exam readiness assessment, or you can do the custom most popular package, which is designed to gauge where you are. So you get a pretest to gauge your strengths and weaknesses. Then based off of the duration that you're telling me that you would like to study, I design a structured study plan for you based off of your pretest results to really hone in on those weak areas. But I work alongside with you during that duration of time that you want to allot to exams. And then we work to take you to a successful board attempt. If those are any of the resources that you may need, feel free to reach out to us. But as always, make sure to meet me back here. Happy studying. Bye, y'all.